All right, today we are diving deep into a personal trainer's playbook for what is honestly one of the most critical moments, that very first client consultation. We're going to be pulling straight from NSCA's Chapter 9 to give you a solid foundational guide for an intake process that's not just effective and professional, but most importantly, safe. So you've got a new client walking through the door. Awesome, but where do you even begin? Well, it all starts with the consultation. And let me tell you, this is way more than just a casual chat. It's a systematic process that really lays the groundwork for their entire fitness journey. Let's walk through this step by step so you can absolutely nail it every single time. First things first, we've got to lay the foundation. Before we even think about the how of that first meeting, we need to be crystal clear on the what. What is your role as a personal trainer, and what are your core responsibilities? Getting this part right isn't just a suggestion, it's non-negotiable. Let's talk about scope of practice, which is really just a formal way of talking about our professional boundaries. Your role is pretty broad, right? You assess, you motivate, you educate, and you train. But honestly, the most crucial part of that definition is knowing your limits. Recognizing when to refer a client to a doctor or a physical therapist isn't a sign of failure. It's the hallmark of a true professional. And to make this super easy to remember, just think of the acronym MATER. You motivate, you assess, you train, you educate, and, when necessary, you refer. This simple framework is like a powerful mental checklist you can run through to make sure you're covering all your professional bases with every single client. Okay, so we've got our role defined. Now let's get down to the nitty-gritty of the first meeting itself. This is the consultation process, and as you're about to see, it's a very clear, logical sequence of steps that are all designed to build a complete picture of your new client. See how these steps just build on each other? It makes so much sense. You start with the interview to even see if you're a good fit for each other. Then comes the really important paperwork. You use that info to evaluate risks, interpret the results, and then you make that key decision. Are we good to go? Or do we need to hit pause and refer out for medical clearance? It's a structured path to a safe start. Now for the paper trail. And trust me on this isn't just busy work. These forms are your primary tools for gathering objective information and, critically, for protecting both you and your client. Let's break down the documents you absolutely have to have. First up is the PARQ. That stands for the Physical Activity Readiness Questionnaire. Think of this as your first line of defense. It's a super simple, quick-to-administer form designed to catch any major red flags that would mean a client has to see their doctor before they even think about doing a single squat with you. So how do you use it? The rule is simple and it's absolute. If a client answers yes to any of those questions, it's a hard stop. You have to refer them to a physician. But, and this is a big but, notice the limitation here. The Part Q doesn't screen for coronary artery disease risk factors, and that's exactly why this is only the first step in our paper trail. Next up, the informed consent form. This one is all about transparency. It clearly lays out the whole program, what you'll be doing, the potential risks involved, the benefits they can expect, and what's required of them as a client. It's all about making sure there are no surprises and that your client is making a fully informed decision to participate. And finally, we have the assumption of risk form, or what most people just call a waiver. This is a straight-up legal document for liability management. The client is formally acknowledging that they understand the inherent risks that come with physical activity, and they agree to participate anyway. It's an absolutely critical form for protecting yourself and your business. All right, the forms are done. Now we pivot from just collecting data to actually analyzing it. It's time to decode all that information we gathered and evaluate our clients' health risks, with a really specific focus on coronary artery disease. So, here are the 8 positive risk factors for coronary artery disease. And you'll notice the level of detail here is key. Look at how specific these criteria are. It's not just smokes, it's current smoker or quit within the last 6 months. Or take dyslipidemia, which is just an abnormal cholesterol level. The numbers have to be precise. Your job is to meticulously go through this checklist with your client's information and tally up their total number of risk factors. But here's a really fascinating twist. There's one negative risk factor, a good one. If your client has high levels of HDL, the good cholesterol, it's actually protective. For any client with an HDL level of 60 or higher, you actually get to subtract one positive risk factor from their total score. It's pretty much the only time a risk factor works in their favor. Okay, Beyond those risk factors, you have to screen for these major signs and symptoms. I want you to think of these as immediate, non-negotiable red flags, things like dizziness or syncope, which is the medical term for fainting, or unexplained ankle swelling, known as edema. If a client reports any of these, the risk factor count doesn't even matter anymore. The process stops, and they need an immediate referral to a healthcare professional, zero exceptions. So now we bring everything together, the PARQ, the health history, that risk factor count, and any of those major symptoms. This all leads us to one crucial decision point where you classify the client's risk level and figure out the path forward. Let's start with the best case scenario, low risk. This is a client who doesn't have any of those red flag symptoms and who has 1 or 0 of the coronary risk factors we just went over. For the most part, they're cleared to begin. Next is moderate risk. This is a client who is also asymptomatic. No red flags, but they've tallied 2 or more of those positive risk factors. With this person, we just need to be more cautious, especially when we start thinking about the intensity of the exercise we have planned for them. And finally, we have the high-risk category. This is anyone who either has a known cardiovascular, pulmonary, or metabolic disease, or, and this part is so important, who presents with 1 or more of those major signs and symptoms we listed. For these individuals, training absolutely cannot begin without medical clearance. This table puts it all together and makes the next step crystal clear. For your low-risk clients, medical clearance isn't necessary. For your moderate-risk clients, you're good for moderate exercise, but clearance is recommended before you jump into a vigorous program. And for anyone in that high-risk category, the rule is simple. Medical clearance is recommended before they begin any exercise program with you. And so it all comes down to this one thing. After you've followed the process, gathered the forms, and analyzed all the data, you face one critical question. The entire system we've just walked through is designed to help you answer it with total confidence. Is your client ready to train, or is it your professional duty to refer them for medical clearance first? Making that call correctly, that is the job.